Lithium is used as a mood stabilizers for bipolar disorder, and it treats acute manic episodes. Now, lithium can be used for mania as well as depression. For mania, it increases the neurotransmitter which act through calcium channel. So neurotransmitter will stimulate the G protein couple receptors, which will stimulate the GQ, which will convert the phosphoenol phosphate into IP3 and DAG and eventually increase calcium. In depression, it decreases the brain derived in depression there is decrease in the brain derived neurotrophic factor, which causes neuroplasticity. Now, lithium will inhibit this GSK3 beta, which will stop the metabolization of BDN and thus increase the brain derived neurotropic factor. Now, lithium is used as a mood stabilizers for bipolar disorder, and it treats acute manic episodes and prevents relapse as well. The pharmacokinetics is that it is 100% absorbed, peaks in around 2 to 4 hours, and the T half life is 24 hours. It is excreted through kidneys 95%, through sweat 4%, and feces less than 1%. The adverse effects include leukocytosis. There is increase in tremors, which is the most common adverse effect. There is hypothyroidism, diabetic insipidus, and there are unwanted movements, acne, hypercalcemia, hyperparathyroidism, and flat T, benign and reversible, flat T wave. There is obesity, and there is nausea, vomiting, and diarrhea. This is actually a symptom of lithium toxicity, and seizures. Now, lithium is in the same group as sodium in the periodic table. So, body does not differentiate between lithium and sodium very easily. So, it enters the lumen of the the collecting duct, enters via same pump as sodium, but it cannot leave, and it gets accumulated and it inhibits the GSK3 beta, and thus it causes diabetes insipidus, which is glycogen synthase kinase. Now, amloride is one drug which is used to treat diabetes insipidus due to lithium. So it will block this channel and prevents accumulation of lithium. Pregnancy abstinence anomaly it will cause, which is basically congenital tricuspid atresia. Lithium can easily close placenta and cause hypothyroidism, decrease the central nervous system, CNS depression, hypotonia, floppy baby syndrome, and cardiac murmurs in the baby. It basically they have to stop lithium 1 to 2 days before delivery. You have to stop lithium. Now, lithium has got interactions with sodium regulation. So you have to regulate the sodium levels in the diet, and the diet and fasting are contraindicated. Sweat, lithium is excreted, sodium levels in the body are normal. So the patient drinks water, and this will cause hyponatremia, and reabsorption is stopped. So patient has to drink a lot of water when he or she is on lithium. Drugs, they have to avoid thiazide because they lost sodium, so they lose lithium as well. Lisinopril and indomethacin. So all these drugs are to be avoided during lithium medication. Plasma levels, T half is 24 hours to 5 days. At trough level, 12 hours after last dose on the 5th day. So acute mania, 0.8 to 1.2 milliequivalent per liter. Bipolar disorder, 0.8 to 0.5 to 0.8. GIT, vomiting and diarrhea. CNS med will cause ataxia, intoxication, and tinnitus. So it can be used eventually for acute mania, bipolar disorder, which is a drug of choice, and depression. Okay, so bipolar, it can be mania or depression. So lithium is the drug of choice in mania. Apart from that, you can use anti-epileptics like carbamazepine, valproate, topiramate, antipsychotics. In case of rapid cyclers, that is, who've got 4 cycles of this per year, the drug of choice will be valproate. In case of depression, lithium prophylaxis, drug of choice, only drug which decreases suicide, and lamotrigine can be used.